a good friend of the show, Todd Minerson, Country Director of Movember Canada, joins me now, and nice to do this in person, my friend.
It's so good to see you, although you're missing a little something from the last time we talked in person.
Yeah, well, you know what? Actually, the last time we spoke in person, I think I was actually getting the shave.
True.
And that was a fun experience. I hadn't gone the full kit and caboodle where you got the big apron sort of thing
the
on.
Hot towel.
The hot towel. And, I mean, that was so much fun. But, man, it's great to spend some time with you. And just before we get into everything with Movember here in our partnership, we got to spend, I don't know, half an hour together sitting up by the rink hole. Wasn't that nice? Just to
What a vibe.
What a vibe, right?
Well, I mean, don't tell our bosses, but we both almost quit our jobs and just hang out for the day.
We both thought about just turning off our phones and just going off the grid for the day because it's about 18 degrees here. It is beautiful. But we're now in year 2 of our partnership with Golf Talk Canada and Movember. And it's been a very important partnership because it was when we initially had our that lunch we had last January, I guess. It was just this match made in heaven, right?
Yeah,
because our target audience are males who are sort of between 25 and 65, I believe, and that's where Movember really steps in is a huge thing.
That's right. You know, we want to change the face of men's health. We want to help guys live healthier, longer, happier lives. And you know, one of the great questions I get all the time, Adam, is like, what do you do the other 11 months of the year? So challenge for us to get out there and chat about men's health during the non-hairiest month of the year in November and have some fun while we do it. And, you know, the audience and the message around good health and taking care of yourself couldn't be more aligned with what you guys are talking about at Golf Talk Canada. And also the way you guys threw yourself into the challenge last year also was an unbelievable experience to watch.
And we'll get into that, and if we're going to make some fashion adjustments in terms of how we're going to rock the mustache. But before we get into what next week is, because it's a big one, these guys playing golf professionally, it can look like a glitzy, glammy life. But if you miss a cut, if you're not bringing in any money, it can be a very lonely life. And that's where the conversation about mental health is such an important one, isn't it?
Yeah, 100%, Adam. You know, we are looking at all aspects of men's health, whether it's physical health, mental health, and some of the things that you might not think are really critical to good health, whether it's your physical or mental, is like, obviously there's the fitness side and the wellness side, but on the mental health side, it's about connection. It's about having good bonds with people. It's about being able to talk about what's going on. It's about knowing it's okay to ask for help and get help. And, you know, we've seen some obviously, you know, very sad experiences in the pro golf world in the last couple of years. Yeah. But what's also amazing is hearing more and more people talk about the upside of getting help, of chatting about it, of like being connected and taking care of your mental health and wellness, not only as a performance factor if you're a professional or if you're not, you know, like it's all in your head anyways. Yeah. But, you know, the wellness it brings to your life. And it's also amazing to see guys out there making choices that balance work-life balance and balance family over career sometimes, and that can be really healthy for men too.
100%. And as we get into next week, it's a big one. It is Men's Health Week. Tell us a little about that.
Yeah, next week is Men's Health Week, and at Movember we're really excited. We're launching the very first deep dive look into men's health in Canada. It's called the Real Face of Men's Health Report. We've launched this report in Australia and UK last year, and we've seen incredible traction from the results of the research that we've done. Unfortunately, it's not all good news. There's some alarming stuff in there, but we also are very keen to point out some of the solutions. So we're learning that, you know, the first thing is, unfortunately, men are still dying too young. Yeah. We're losing, on average, 2 out of every 5 men are dying prematurely. That's before the age of 75. And in real human numbers, in 2023, that was 75,000 men who died prematurely. Wow. Largely from preventable causes. Mm-hmm. Things like health literacy, things like going to the doctor, things like just being more active in your own health. The second thing we learned is that when we are engaging with the healthcare system, it's not working great for us sometimes. Things like stigma and fear of getting help and delaying seeking care are still really preventing us from getting the best health outcomes. The third thing was most important thing that we learned, the impact on everybody who cares about us. You know, the ripple effect on caregivers, on partners, and to the economy. $12.4 billion a year could be saved if we improve. Yes, I said a B.
What?
$12.4 billion a year could be saved if we invest in prevention and better health for men. Wow. And that's only on the system-wide. We know the survey that we did, 2/3 of people who are caring for somebody, a man who has poor physical or mental health, say it's affecting their own mental health. and half of them say it's affecting their finances as well. So all of this leading to us pointing to a call for a national men's health strategy and hoping that we can work with politicians and decision makers in the coming years to really get to that place.
That's a lot of information there, and a lot of vital and important information. So I know we have strategies with us, Golf Talk Canada and Movember, but what can we all do, everyone watching, everyone listening, do on a daily basis to help move this forward and help improve what you just spoke about?
Yeah, there's a ton of things that individuals can do. You can obviously stay connected, but you can also take some more agency over your own health. One of the things we found in the report, Adam, and I mean, you and I can probably relate to this on some level, but 65% of men waited 6 days to see a doctor when they had symptoms. And I'm not talking like, is this allergies or a cold kind of stuff? Like, is my arm falling off? Should I see a doctor? But 1 in 10 guys waited almost 2 years to seek help after symptoms of such serious illness. So there's things that we can do ourselves. There's things we can do around taking care of each other, staying connected, checking in on your friends, encouraging them to get help if they need it. Even being that supportive voice in their head that says, it's okay. Like, I know it's scary, but like, let's get that checked out, and tell me how it goes. But we also are learning you can't do it alone. So that's why we're getting into this space of understanding how governments have a role, research has a role, and we have to get to some of the systems change to really move the needle and get a better outcome for men.
Wow. Well, Men's Health Week is next week, and we are doing so much Movember and Golf Talk Canada here moving forward. Do you want to give us a little teaser on what Movember and GTC maybe have in store here?
Well, we're getting some, clever ways to get people involved in the next couple of months. I know there's a few mustache farmers on set here that, some can grow them in half an hour, some can grow them in a couple of days. But it's really fun. And other things people can do, just even having the chance to talk about the report, encourage people to check out Movember.com next week and have access to the report, share it with your friends and start some of those conversations. But there's going to be some fun things cooking up in the next couple of months between us.
Oh, yeah. We're in conversation here with Todd Minerson, Country Director, Movember Canada. And you mentioned it a little earlier, how GTC, we raised a bunch of money last year, just over $5,000. And Bob didn't grow the mustache, but did Movember.
Yes.
Where he ran 131 kilometers. For those who aren't aware of what Movember is, tell us about that.
Yeah, there's lots of ways to get involved in Movember. It's not just growing a mustache, obviously. There's a lot of people who can't or don't want to, or, in fact, my family was kind of shocked to see this poor man's Graham Delat show up for June this year instead of November. So we encourage people to move for men's health, and Bob was amazing last year. Although, speaking of sandbaggers, I think he was a little bit of a sandbagger, setting his original target so low and then crushing it with the 131 kilometers, barely breaking a sweat.
I don't think any of us have like you, Mark, and I probably haven't ran 131 kilometers in our lives combined.
If a bear was chasing me in the woods, I couldn't run 131 kilometers.
I just give up. That's it.
That's right. See, boys, I'll take one for the team here.
But in terms of next year or this coming Movember, Mark and I are going to grow again. Who do you think grew the better stash last year?
Wow, that's like picking who's your favorite kid.
Yes.
You can't really do
it.
I
ask the tough questions here.
You can't really do it on air, but you can do it in other places. I'd say, listen, Mark started strong because he's that kind of guy who can, like I said, grow it in an afafternoon, right? But I felt like you needed to really find your groove, pace into it. And I got to say, by the end, I'm going to give you the nod. I'm going to give you the nod. By a whisker, no pun intended.
Yes. Okay, I love this. Now, last year, I had the stash. I had the sort of Fu Manchu, the soul patch going. Do you think I switch it up this year? Something a little different, maybe?
You got some time to consult. I think you're obviously going to have to wait until after your big day before you can
22
really
days.
Start those trials and efforts and everything like that. But I don't know. I'm looking at you. I'm thinking there's a little bit of a Tom Selleck vibe maybe going on there.
Really?
The memes are going around now. But you got to power it out first and then kind of carve it in later. That's the methodology. Really.
Yes. Well, we are so proud to be the official men's health sponsor and partner of with Movember, with Golf Talk Canada. We love our partnership with you guys, and it's so much fun whenever we get the chance to. We've done a couple of remote interviews, but to actually do this in person was so much fun. Todd, it was great to spend some time with you this morning as well. I know you have a big drive after this, but let's do this again in person sometime too. And before Movember too. Let's do
do
something between now and then in person.
I think we're going to be sharing with a few people how to maybe do that lead up to Movember. Maybe we'll do that one in person. What do you think?
I love that.
All
I
right.
love when we make plans on the air. That's the favorite one of my favorite things we do here on Golf.
Whip out our
Canada.
calendars. And
Yeah,
book some
exactly.
times.
Calendar invite
Great
live on
TV.
the air. Great TV. Todd, thanks for your time. Really appreciate it.
Yeah, thanks, Adam. Appreciate you guys.